Good morning, everybody, and welcome to our April Security Health Plan Academy. Today's webinar focuses on preventive care and why it matters. We are so fortunate to have Dr. Brandon Parkhurst here to present on this important topic. He'll dive into the benefits of annual wellness exams and help you to understand what they entail and how they can help us to catch issues early when they are often easier to treat. He'll discuss the importance of staying current on those vaccinations and explore cancer screenings, as well as coach you on how to take control of your health. Dr. Brandon Parkhurst has been a part of Marshfield Clinic Health System for more than 23 years. In addition to being a primary care physician, he has served in leadership roles in Marshfield Clinic Health System, Institute for Quality, Innovation, and Patient Safety, Patient Experience, and the Adult Primary Care Service Line. A native of Missouri, Dr. Parkhurst moved to Wisconsin in 1997, and he says he still hasn't acclimated to the long Wisconsin winters. Although I would say this year has been kind of short, or it's felt that way. So I don't know, this year might be better. So without further ado, Dr. Parkhurst, I'm going to hand this over to you. Thank you so much for your willingness to present on this important topic.
Yeah, thank you so much, Ashley. And yeah, I'm not sure winter this year counted. That was the best it's been, at least since I moved here in 1997 in 97. But again, welcome everybody. We will be speaking today again about why routine preventive care is important for all of us, but specifically for those of us who might be over 65. And so our agenda today, you will learn about why routine preventive care is essential for those over 65. We'll talk about the benefits of the Medicare annual wellness exams. We will talk about the importance of staying current on vaccines. We'll talk about cancer screenings, and we'll talk about screenings for other chronic conditions as well that you may be aware of. We will also have time for questions and answers at the end. We have a few questions that we received in advance. And if folks have questions, you can certainly type them in the chat. Since I'm sharing, I can't see the chat right now, but we do have someone monitoring, and we'll be able to receive those questions and answer them. And so why is preventive screening important? And the simple answer is to help you live your best life. Preventive services are essential for everyone, and really critical even as we get older, because the intention of a preventive service is to catch an illness before it has the chance to impact your health negatively. Unfortunately for all of us, as we celebrate, as the number of birthdays that we've celebrated adds up, our risk for health problems increases. And then early detection of these health problems increases our ability as healthcare providers to reduce the impact of those health problems and to help you live longer and healthier and a more satisfying life. So the benefits of annual wellness visits are kind of listed out there on the screen. I will go through them and sort of talk about them a little bit, but we're going to measure your height, weight, blood pressure. We're going to evaluate your medical and social history, including medications and supplements. We do a health risk assessment. We create a list of medical providers that are involved in your care so that we can help coordinate those cares as a primary care physician or as primary care providers. We assess risk factors for conditions such as depression, your functional ability, hearing, activities of daily living. And we do assess your risk of falls and try to assess your home safety. We establish a list of those risk factors and conditions that may need to be addressed as part of your ongoing healthcare. We provide a written screening schedule, including suggested screening services and tests. And then we give health advice and refer to specialists as needed. And I will pause right here to answer one of the questions that came in advance. And that question was, and I've got it written down, what is the difference between routine preventive exam and a Medicare wellness exam? And the simple answer, without going into a ton of detail, is that they're really simply just two different codes, two different sort of billing codes, if you will. A routine preventive exam is a preventive exam that is covered by most insurers, but which historically was not covered by Medicare. Several years ago, it's over a decade now, Medicare created the Medicare wellness exam in response to patients and providers asking for that preventive service benefit. And so the annual medical exam was what was created out of there. So just two different codes, slightly different components to each one. And for those of you who have Medicare, you probably realize Medicare is very diligent, very focused about defining, the components of when the components that need to be included when submitting a given bill. And so Medicare does have a fairly robust list of components that are necessary for an annual wellness exam. And some of those are actually what you're seeing in front of you right now. And so the answer to that question is, what's the difference? Well, they're really just two different codes, are really intended for very similar benefits. Again, the medical annual wellness visit applies to folks who have Medicare, so who are largely over 65. The other code generally applies to folks who are under age 65. Again, that's a high level. Exceptions can and will and do exist. So one of the things that I wanted to speak about today is cancer screening. And so there are currently 5 cancers, 5 cancer screening exams that are routinely covered by Medicare. We will talk about 3 of them in the upcoming slides. The 2 that we will not be speaking about today are cervical cancer screening and prostate cancer screening. But know that Medicare does cover both of those. And as you have a wellness exam, you'll see that those benefits are explained to you. The reason we screen for cancers as providers is very, very simple. For many cancers, specifically these 5, we can identify, there's a time where we can identify the cancer before it has started to cause significant symptoms for you. And when we detect that cancer early, we have the ability to intervene with treatment that presents a higher likelihood, a higher capability of curing that cancer and increasing your risk of survival and decreasing the impact of that cancer on your day-to-day life. That is, in a nutshell, why we do cancer screening. That early detection period is not available for all cancers. And so that is why we don't screen for all cancers. One of the components of screening to make it important is that, or to make it effective, is that the illness that is being screened for needs to be common or relatively common. And the screening test needs to be relatively easy, relatively low impact. And if it's not super expensive, then that's ideal too. And getting back to the, maybe I'll end with the point to the upper left, which is that for cancer, early detection really is the key so that we can get those treatments started as quick as possible. And so the first cancer screening that we're going to talk about today is breast cancer screening. This applies largely to women. Screening starts at age 40 and extends through age 75, although in some cases we may extend that a little before 40 or after 75, depending upon a given individual's family health history or current health happening at 75. There are largely 2 exams that we do for breast cancer screening, and that is a clinical breast exam or a screening mammogram. There are other tests, such as ultrasound or a breast MRI, that we will sometimes do to evaluate an abnormality that's found on a clinical breast exam or a screening mammogram, but those fall more into the diagnostic realm rather than screening, and so I won't touch on those things today. The second cancer that I want to speak about is lung cancer screening, and this is a relatively new event, really only becoming common in the last decade or so. And so screening for lung cancer is done through only one test. It's done through something called the low-dose computed tomography, or CT scan. screening is recommended for individuals who meet all of the criteria that are listed on the screen in front of you. So when an individual has more than 20 years or 20 pack years of smoking history, so 1 year of smoking equals, 1 year of smoking, 1 pack per day equals 1 pack year of smoking. So 20 years of smoking, 1 pack per day would qualify. 10 years of smoking, 2 packs per day would qualify. So that's requirement number 1. Requirement number 2 is that you smoke now or that you have quit within the past 15 years. And then the third requirement is that you are between age 50 and 80. And if you meet all 3 of those criteria, the recommendation is to have a low-dose CT scan for lung cancer screening yearly. I didn't mention it on the previous slide, but breast cancer screening is also recommended yearly. And so these first 2 are yearly examinations, yearly screening tests. The third cancer that I'll speak about today is colorectal cancer or colon cancer screening. We typically screen all adults between ages 45 and 75. There are individuals that we will screen earlier than age 45 due to their family history. And also in front of you, there are 4 different tests that we currently use to screen for colon cancer. The only of these 4, the only 2 that are fairly common are the one that is at the top, a stool sample. So most recently, the most common stool sample testing that we've done, that we do for colon cancer screening is a test called Cologuard. You've probably seen it talked about on the TV, although we also sometimes continue to do a fecal occult blood or a FIT test. You'll see that there's slightly different intervals between those 2. So a Cologuard, if you have Cologuard screening, you don't have to have screening done again for 3 years. If you have a FIT test, then you need to have that yearly. Flexible sigmoidoscopy is similar to a colonoscopy. The main difference is that with the flex sig, the only part of the colon that is looked at is the last 1/3 or so of the colon. By and large, with other tests available, we don't do this as commonly today. The other test that we do very commonly is a colonoscopy. And if anyone has had one, you remember it very well. A colonoscopy is a test where we take a long tube and we look at the entirety of the large intestine, looking for cancers and looking for precancerous growths that can actually be actively removed at the time of that testing. And so the typical screening interval for a colonoscopy, if there are no findings, is every 10 years. But if there are findings on a colonoscopy, that screening interval is often accelerated, sometimes to every yearly, but more commonly to every 3 to 5 years. And then there's also a test called a CT colonography. Again, this is similar to the low-dose CT scanning for lung cancer screening. It's performed only in a hospital or in clinics, and again, happens every 5 years, but pretty uncommon. The next thing that I'll take the opportunity to speak about today is vaccines. So the vaccinations that are on your screens are the vaccinations that are right now routinely covered by Medicare. Flu shots, pretty self-explanatory. I'm not going to go into that in super detail. They happen yearly. COVID-19 vaccinations, sort of new, again, looking like they're probably going to happen yearly. Zoster is also called shingles, and there is a vaccination for shingles. It's been around for several years. That is approved for individuals over age 50, and the zoster vaccination is a 2-dose series of vaccinations. If you've had one, then you also realize that vaccination can sometimes make you feel a little sore. So as far as side effects, the zoster vaccination is maybe a little more laden with side effects than some of the others. A Tdap or a tetanus booster happens every 10 years. Hepatitis B vaccinations are covered if you happen to be an individual who has not received the hepatitis B vaccination series. It's actually a series of 3 shots. When I started medical school, hepatitis B vaccinations were not super commonplace, but were required for us. That was 1993. Since then, they've actually become commonplace, and all hepatitis B vaccinations are required for all infants today. RSV, or respiratory syncytial virus, is also a relatively new vaccination. Again, really only coming in the last year, 2 years. That is recommended for individuals ages 60 and above. That is a yearly vaccination, as I recall. It's new enough that I'm forgetting. And then pneumococcal vaccination is the one that has maybe caused the most confusion. That's a shot against that protects against a common bacteria that causes pneumonia. One of the questions that we received was, is one pneumonia immunization enough, or do you need to get a booster or repeat each year? And so I will take the time to answer that question. And the answer is, it depends. And it's actually changed over the years as well. So right now, there are 4 different pneumonia vaccines that individuals might have gotten. They all have slightly different letters to begin the vaccine, but they all end in a number. And so the 4, the first ends in the number 13, the second 15, the third 20, and the fourth 23. And so if a given individual has their first pneumonia vaccination of the vaccine that ends in 20, you only need 1. For all of the others, you need 2. And to answer the question, you do not need yearly pneumonia vaccinations. And as of right now, there is no one that needs more than 2. The next thing I'll speak about, we'll transition into screening for other sort of healthcare conditions that can sort of exist silently. And the first that we'll talk about is cardiovascular screening. This is cardiovascular screening is really Medicare's verbiage for cholesterol screening. And so there really is one test for cardiovascular screening. It's recommended annually after the age of 40 through 75. It is done through a blood test to check your cholesterols, and you'll typically get a result that shows 4 different levels: your total cholesterol, your HDL, which is sometimes called the good cholesterol, your LDL, which is sometimes called the bad cholesterol, and triglycerides, which are actually free fatty acids in the blood. It's also worthwhile noting that on your first Medicare annual wellness examination, you can also receive an EKG, which is an electrical test to monitor your heart function. That is only performed once, or at that first visit. At every annual wellness visit, and really at every visit when a patient comes to the provider or comes to the clinic, we do blood pressure screening. We check your blood pressure. And the reason we do this, y'all who are on this webinar may well know that elevated blood pressure is actually called the silent killer. And it's called the silent killer because there are really very few symptoms of an elevated blood pressure. Yet if your blood pressure is elevated over time, years to several years, it increases your risk substantially for things like heart attacks, strokes, kidney disease, other vascular diseases in the body, can be a cause of blindness. And so we test blood pressures for folks who come to the clinic. Again, every clinic visit by and large, just so that we can catch elevated blood pressure when it's happening, so that we can start to take actions as a provider and as patients to help lower that blood pressure. We also do diabetes screening as part of the annual wellness examination. The diabetes screening is done through a blood test called the fasting blood sugar, and they're typically done every 1 to 3 years, depending upon your specific risk factors. We test for diabetes because diabetes can also develop relatively silently. And if you have diabetes, we do additional tests, things like a hemoglobin A1C, things like evaluations of your kidneys, a foot exam, and an eye exam to look for some of the complications of diabetes. I sort of anticipate that there may be some folks on this call who are diabetic. I am usually very transparent about the fact that I am a diabetic. I actually got type 1 diabetes, developed it when I was a child, so I take shots. It is not the end of the world, and if you take care of yourself, you can lead a long and happy and uncomplicated life with diabetes. I believe, as I'm thinking about my slides, the last screening test that I'll speak about today is osteoporosis screening. This is a test for thinning of the bones. And the reason we screen for osteoporosis is because as we get older, our bones do tend to lose some of the calcium that was originally in them. And as our bones get thin, if we happen to fall, we're at increased risk of broken bones. Fractures like wrist fractures, hip fractures, rib fractures, collarbones, all fairly common. And unfortunately, some of those fractures can trigger additional medical complications down the line if you have them. Most hip fractures are treated with a hip replacement. And again, you can see the ages for osteoporosis screening and where we get them started and how we do them. Osteoporosis screening is typically done with something called a bone density scan. And with that, I will stop sharing and will gladly answer any questions that folks might have. I do not. Have we had any questions in the chat?
So I was just going to type in, and we don't have anything yet, but everybody is welcome to submit a question, and we will read them as we get them in. But I will go ahead and ask some of the questions that we had submitted in advance of today's webinar,
Yeah,
and
of
maybe we
course.
can work through some of those.
Yeah.
The first question I'd like to ask was, would it be more beneficial to have an initial brain through body scan done to spot irregularities before becoming major issues later as a preventive wellness checkup instead of just cognitive test review of meds and blood and vitals checked?
Yeah,
That was the first of the two questions.
that's it's a great question and one that I get fairly commonly as a physician in my office. So the answer to the question, which was, would it be better to do the kind of a whole body scan, is no, and I'll share why. When we do a whole body scan, it does, and it can detect abnormalities. Unfortunately, the abnormalities that it can detect are sometimes real and sometimes not real. And so when a scan detects an abnormality that is, well, an abnormality, there is additional testing that needs to be done, downstream. And some of those findings will even lead to interventions like surgeries. And so we don't do scans like this because of those downstream risks. Those downstream sort of additional tests are felt to be more risk than not doing the test. And so for more advanced testing like scans, we really need to have a patient, we wait until a patient has symptoms because those symptoms help us interpret the scans and help us understand the results in a way that produces more favorable outcomes to the patients that are having the scan. That's a simple answer. There again, I could go into more complex detail if necessary, but it is a common it's a common sort of misperception. If you can do a test like a whole body MRI, why don't you just do that? The other thing to be aware of is that if we started doing whole body MRIs on every individual in the population, we would actually need many, many more MRI scanners than we currently have. And the cost for those scans would go up. And so we end up with a healthcare delivery system that is strained even more due to those demands and costs.
Okay, there was
I saw a chat come in. Did that
yeah,
was that a question, or was
yeah.
that a question about my answer, or uh,
Well, the first question that we had come through was for the regular exam, not wellness test, is there a physical hands-on exam of lymph nodes, abdomen, etc.?
yeah. So for the Medicare annual wellness exam, uh, for the subsequent annual wellness exam, there is not a physical exam component that is required other than uh, testing the blood pressure, checking the pulse, as I spoke about. So there is not a specific physical exam component that is required. Most providers, most of us do them, when we do an annual wellness exam, but it is not required.
All right. Another question we had come through were what are the three wellness screenings that a person can get when they've first signed up for Medicare? If the physical hasn't been done during the first year, can the patient get test upon request?
Could you repeat that question again?
Yeah, sure. Or sorry, not physical, physician. So the question was, what are the three wellness screenings that a person can get when they first signed up for Medicare? If the physician hasn't done those during the first year, can the patient get the test upon request?
Ooh, yeah. So I'm a little confused by the three screenings, I think was the word that you can get upon um, signing up for Medicare. There's actually a list of many screenings. I mean, we went through more than three today, and the actual list of screenings is probably that are potentially covered is it's probably oof, 35 uh,
Oh,
individuals, or 35 components long that kind of variously apply. If a beneficiary of Medicare does not have an initial annual wellness exam, does not have a welcome to Medicare exam in the first year of Medicare, then they no longer are eligible for that specific exam. Again, there are really three different codes that we use to code these exams. So the first is called Welcome to Medicare. That's done during the first year after an individual enrolls in Medicare. The second is called an initial annual wellness exam, and that's like the annual wellness visit, or that's like the Welcome to Medicare, only done after that first year. And then the third is called the annual wellness visit, or the subsequent wellness visit. And so those are the three codes. Those are out there and available. And then the last part of that question was, can a patient request tests? I think, and that's really based upon your relationship with your provider. Most of us as providers do like to see patients when we're ordering any tests, so that it gives us it gives us information about how to interpret those tests, and information that we use. Some providers may not. Did I answer that question for the asker?
and they can maybe message me in the chat,
Yeah,
let
I
me
was gonna say
know.
you can say yes or no.
Part two to that question is there a dermatology checkup annually to check in for skin cancers?
There is not a dermatology exam that is included as part of that sort of screening list that I immediately recall. Um, so I believe the answer to that is no. Although, and so again, I gave you a straight answer. I think it's also worthwhile to recognize, though, that As part of your annual wellness exam that you may have with your primary care provider, it would be important to bring up any concerning lesions that you might have. I, as a primary care, would certainly take a primary care provider would take a look at them. Certainly, there are many skin cancers that I'm kind of comfortable recognizing. But if there was something that seemed worrisome or suspicious that we needed to get dermatology involved for, I would absolutely do that.
Great. Well, we are at time. We can let you go for today, Dr. Parkhurst, but thank you so much for joining us. And any other questions that today's audience members might have, you're welcome to email those in or write those in, and we can get them answered for you. And I think that should be it. So thank you so much.
Okay, thank you, everyone. Again, yeah, please send your questions. The team can get them to me. I will make sure that we get answers to you and that all of the questions are answered. And once more, thanks to the team to put this on. And thank you for everybody for attending. Have a
Yes.
great day now.
Have a great day. Be well, everyone.